And one of the changes we could be seeing as a result of the election is something that has been part of the water we drink every day. Fluoride in water has become a topic of controversy. Experts say it cuts down on tooth decay nationwide, while others say its risks outweigh the benefits. Queen City News anchor Derek Dellinger has a look at why it is getting a second look.
All the talk that's happening right now surrounding fluoride in water echoes a lot of what we've heard in the last few years from people against it, questioning the health effects of something that has been in our water for decades and something that experts say has proven successful. But Robert F. Kennedy Jr.'s likely appointment to a public health position and the incoming Trump administration has many, including us, taking a look at what's already been seen here locally on that front. Those who support fluoride in water say the calls against it are a political dog whistle, something meant to address and perpetuate fears related to scientific and medical breakthroughs, and they cite numerous studies for fluoride's benefit. Earlier this year, we had a chance to speak with Frank Kortz on this issue. He's the chair of the North Carolina Dental Society's Council on Oral Health and Prevention and is one to maintain that fluoride does have a benefit.
I think they have legitimate concerns about the safety, and I think the science has adequately addressed that and continues to address that.
But there have been calls going on for a while now against it. We saw signs of this earlier this year in Union County after numerous public comments led to commissioners ultimately voting to end putting fluoride in their county water system, citing studies indicating lower IQ and calling it forced medication, both things that experts say have no large merit.
This is the only drug that's given with no prescription and no consideration for an individual's health status.
I'm here to tell you why I believe water fluoridation is the biggest public health scam of the 20th century.
It's something that is a mineral. It's not a medication. And it's something that, just like calcium makes bones strong, fluoride makes teeth strong and resistant to decay.
This is now something we will likely hear more of. Robert F. Kennedy Jr., who reportedly has been promised a position of public health in the Trump administration and is known for his views against vaccines, among other public health initiatives, has posted on social media. In fact, he did so earlier this month before the election, saying the incoming Trump administration would advise water systems to remove fluoride from water. It's something that is right now left up to local decision. A federal court ruling back in September said federal authorities should further regulate its use in water because of those perceived risks. There also used to be more fluoride in water, but given the fact that it's in everything from sports drinks to sodas, levels in tap water were reduced.
It's proven to be safe and effective over and over again. And it's something that if North Carolina didn't have fluoride in the drinking water, it would amount to hundreds of millions of dollars in additional dental costs for the citizens of North Carolina.
We should mention that we did reach out to Union County to see how that end of fluoridation has gone so far. However, the county told us since that vote, there are no updates or developments related to that decision. Derek Dellinger, Queen City News.